surgical background, but nothing gets closer to be here with you. This is what I graduated for, is to talk with each one of you and make things better. So this is why I'm here for. So I hope, it's okay? Okay. I hope that if I can come back next year or in the following years, I will see you all feeling better. And I saw a t-shirt around here that I love it. And I want to make a deal with you guys. If you have youth in your home, Johnson & Johnson will make you move. We're gonna be responsible for keep you moving. So let's work together. You all keep your youth in your heart. And Johnson & Johnson will help you your bones and joints. Deal? Okay. Okay, here we go. So we're going to be talking, before I start, it's challenge. After the band, entertain you will be very challenged, but I will try my best. So we have here that studies show that racial and ethnic minorities receive lower quality health care than non-minorities, even when insurance status, income, age, and severity of conditions are comparable. How come? Why is that so? There's not a good way. Okay. Again. Here we go. And why do these disparities exist? And we have some bullet points that may be showing why this happened. First of all, fear and mistrust. Many times I hear from my mother say, I don't want to go to the doctor because if I go there, they will find me something. So better if I don't go. And I say, Mom, no, this is totally wrong. Go there, and together with the doctor, you may be able to find a solution. So if you hide, you won't be educating yourself to how to deal with the condition that you have. So one is lack of fear and mistrust, lack of knowledge. We have to be empowerful to know what can be help to us, what can help us to live a better life. So when you don't look for help, you won't be helped. So you have to communicate. You have to talk to our peers. You have to talk with our family. Say, you know what, I'm feeling this. Are you feeling the same? So what you did, how you can, do you have a good doctor that you can refer me? So you have to communicate. Lack of communication or poor communication is also another point that put us away from better conditions. Cultural difference between doctors and patients. You know what? Many times I felt like when I receive patients in my office and they come like scared, insecure, afraid, I say, okay, you know what? Let's talk eye to eye. How can I help you? What can I do for you to make you feel better, to make you live better? And this is what we are here for. And you should demand that. You deserve that. You deserve this kind of care. So next time that you go to your doctor, make all the questions that you may have. They are there for you. And you should use your right in being knowledgeable about the condition that you're presenting. It's our responsibility to clarify your doubts. It's our responsibility to make you leave our office with a better knowledge. It's the only way that we can work together to be to have a good outcome. I need your help because I won't be with you all the day, every day. So I need you and us be a team. Next time, when you are in your doctor's appointment, make all the questions. Write it down. Everything that comes to your mind, write it down and take with you to your doctor's appointment. And make them clarify all the questions that you may have. Okay? You have to do that. It's the only way that we can help. We have to work together. And this is how you can change this. This is pretty much about what I just said. Knowledge is power. Understanding lessens fear. And we have to understand, in terms of joints, we have to understand what's going on with our joints. What we can do to make it work better. What can make it work worse. And we have to be aware of all this differentiation. How you can help us to keep it moving. So we have to be in power of our own treatment. And when we talk to the doctor, again, make all the questions possible, clarify. And sometimes you don't believe that small changes are powerful. And believe me, they are. If you start small movements, a small exercise, just the way that you wake up at the end of 2 weeks, you will feel like, I'm feeling better. I'm feeling less pain in my joints. So small changes make a miracle. You have to believe on that. This control is bringing me. Okay. So let's talk specifically about knees and hips. Okay? This is a little bit of hip joint, hip. Okay? So on the hip, we have one big bone that is the pelvis, and you have the femur coming to connect with the pelvis bone. Okay? So where this connection happens is right here, and we call this hip socket. So this is one part of the joint, and this is the other part of the joint. So this is the femur, the thigh bone, and the thigh bone connect with this bone here that is the pelvis. So, and this is the ball and socket joint. This is how you call hip. And this is a normal hip. And this is the knee. In the knee, we have the knee joint is compounded by 3 bones. The femur, the tibia, the skin bone, and a little calf that calls patella. We call kneecap. This bone, round bone here. These 3 bones together made up the knee joint. What is osteoarthritis? So, this is the definition of osteoarthritis. Progressive, let me point out here, progressive irreversible loss of articular cartilage that leads to pain, stiffness, loss of mobility, and sometimes deformity. Some of you, and me as well, we have white hair. I used to say to my patients that osteoarthritis is the white hair of the joints. Everybody will have one. Everybody at some point of our lives, even without the trauma, we will end up with some osteoarthritis. It's the natural worn out of the joints. So the same way that you have wrinkles, white hair, a little bit of overweight, this is how the body reacts to passing time. And you know what? Better to have osteoarthritis than the other option. Get older is a bliss. Because the other option is a way worse, right? So let's try to have a good process of aging, because again, it's a blessing. So, we have to be happy that we are able to get older. I am very happy, because the other option's not so good. What osteoarthritis mean? In medicine, you use a lot of prefix and suffix that comes from Latin. And so, osteo means bone, arthro means joint, and itis means inflammation. So, normally, you will hear your doctor saying that osteoarthritis is an inflammation on the bone and articulation. Or you can hear the doctor saying that you have a sinusitis, is the inflammation of the sinus. Or you can have, so every time that you hear the word ending with itis, that means inflammation. Here you see a healthy knee joint, a healthy hip joint, and on the other side you see the diseased one. All of you already saw a healthy joint. You know when? Remember when you eat a chicken thigh? At the extremity of the bone of a chicken thigh, you see something white, shiny, and smooth. This is how a normal articulation surface is. Ours, pretty much the same. So, the normal joint is exactly like you remember of the chicken thigh. It's exactly the same. Very white, very smooth, and very shiny. The healthy one. With the time passed, with some trauma, with some overweight, there is some situations that aggravate this condition of a normal joint, and it becomes to be disease. And why we have that is a lot of different reasons, but just aging is one of them. Because if you think that our knees and our hips are supporting the weight of our bodies for 60, 70, 80 years, every single day, it's impossible. Don't get ways out. So we'll be worn, we'll be, damaged somehow. Because it's a lot of time and a lot of weight. Even if you're not severely weighted, but even still, a long time that they are supporting the body weight. When you look at the bone, the normal bone and the surface, so just beneath this white line here is the articulation. Okay, so just beneath that, there is a bone that you call under articulate. Just beneath the cartilage. So you call that subchondral bone. When this subchondral bone start to perceive, understand that something is going wrong with the cartilage, they start to produce to help the body. So they start to produce. But the thing is, bone does not produce cartilage. Bone produces bone. And so at some point, when you look at the subchondral bone, you will see that the subchondral bone has a lot of space. And this is why. Also, when this subchondral bone starts to produce bone, the space between the two joints, so the femur and the tibia, in the case of the knee, gets smaller. Because the space that was occupied by the cartilage, when the cartilage starts to be destroyed, the space gets lesser and lesser. Pretty much the same happens with the hip. the same physiopathology, the same process of disease is happening. So normally, when it starts to happen in your entire body. Maybe more sensitive to the knees, or more sensitive to the hip, maybe more sensitive to one side to the other, but normally is a full body process. So when it started all over. Of course, will be more prevalent in the articulations that hold the weight. So this is why hips and knee are more sensitive to that. The joint with osteoarthritis has some characteristics. We not necessarily present all of them, but those are the ones that normally we will be complaining about. And the first of all is painful. We have a lot of pain in our joints when you have osteoarthritis. And we will notice, and we don't know why, the science don't know why in the winter time is more sensitive. So sometimes you say, the weather will change. My knee is hurting a lot. We don't know why, but we are more sensitive to the cold situations. So sometimes people with osteoarthritis can, forecast the weather. Because if it's hurting more, probably will start to rain in some hours from now. We have painful, you have stiff, we have swollen, deformed, noise, and instability. Necessarily, we all have all of this characteristic? No. Not necessarily we will present with the full conditions, but probably we'll have one of them, more than one. Varies from patient to patient. During the physical exam, when you get to your office, to your orthopedic office, what we're going to do is to start to a physical exam. In this physical exam, we'll do a visual inspection. So we want to see how your joint is presenting. That is swallow, that is deformity, that is instability. So I will start doing a visual inspection. And then I will look for effusion, is swallow, that is liquid inside. What is the range of motion? What I mean by that? How much we're able to flex, and stand your knee or your hip. This is the range of motion. So what is the graduation that you are able to move without presenting pain? There is any instability. When I move your knee, I feel like some instability. And something that is important is the BMI, the body mass index. Why? Remember that I told you that the joints are supporting the weight. So if you put more weight, there will be more damage. So this is why the weight control is important for joint healthiness. About the pain, we have a graduation. In medicine, you have graduation for everything. So you have a graduation for pain as well. And your doctor will ask you, okay, in a range of 0 or 1 to 10, how you point that your pain is. And you have to tell us, okay, it's 1 to 3, it's 4 to 7, it's 4 to 7, it's 8 to 10. And then you get an x-ray of your joints. When you look at the x-ray, this is a knee x-ray, and this is a hip x-ray. You have a normal knee, you have an abnormal knee. And remember that I mentioned to you that the space in the joint in a normal knee will be larger than the space in the diseased knee. And this is how it will be showing up. You see the difference between this space and this space, this space and this space? Is because that is a bone production. So the virtual space before has nothing and now has bone growing up there. So this is why we have this less space than in a normal knee. Same thing happens in osteoarthritic hip. You see all this bone here if you compare with the normal hip. So you can follow the lines in the normal hip. So here is the femur, here is the acetabulum in the normal hip, and there is a space between them. Here is this mass with a lot of bone production, less space between the bones. So the reason that we have cartilage surface is just to protect the contact of bone with bone. So you have the cartilage to protect this contact. The contact of bone to bone is very painful. The bone, the subchondral bone, the bone that is just beneath the cartilage, is very innervated. So any contact with this bone will be very painful. So this is why when you don't have the cartilage to protect, it's so painful. And you have a lot of things that you can do to control pain. So we list here some of them. So there is anti-inflammatory drugs, there is glucosamine sulfate, hyaluronic acid injections, any kind of local pain relief. So there is a bunch of things that you can use, to help you get rid of the pain. Even sleeves, brace, skin and walkers, physical therapy, and acupuncture. So all of them helps to get rid of the pain. But you have a big watch out. And I will tell you what it is. We have to be careful because pain is not a normal symptom in our body. Pain is just one alert. When you're feeling pain anywhere, something is not right. So, like fever is one indication of something is going wrong with your body. Pain, same way. Pay attention to the signals of your body. So, and the problem sometimes is when I have pain and I use some anti-inflammatory drug and the pain go away, I just forgot about it. And then I don't pay attention to what's the cause of my pain. So you have to be, okay, if I have a pain, I will take anti-inflammatory drugs or I will pass some balms here and the pain will go away, but I cannot just forget about that. I have to investigate it. And this is what I was talking to you about, knowledge. You are in control. You have to be in control of your own body. So if you feel some pain, let's investigate. What could be the cause of it? So here we list some non-surgical treatment that can help you, in some stages before you go to any surgery. So again, you have the pain controlling, you have activity modification, weight reduction, and physical therapy. And why this is important? If I know that I am overcharging my joints because of my overweight, is a good thinking to start to taking care of my weight. So because my weight is overwhelming my joints, my overweight is overwhelming my body in a different ways. So probably I also will have some other traces of disease like hypercholesterol, hyperlipidemia. So, we have to be careful about that. And there is some indicators that Black population, there is a bigger chance of being overweight. So consequently, Black population will have a little more aggravated chance to be with osteoarthritis. So, and osteoarthritis, once started, is a progressive disease. But if you can avoid to start, or at least if you can avoid to aggravate it even more, we have to do that. And it's in your hands. This control is all yours. So use it. you are, you have this power. Use it. It's in your own benefit. And then you have some options when everything else failed. So you start with pain control, and then you go to physical therapy, using a brace and cans. And so everything is not giving you the results that you were expecting. You still have another options for you. And that option is the surgical treatment. And is one surgical treatment? No, we have different options of surgical treatment to treat that disease. Some of them are aspiration, because many times when you have osteoarthritis, you see that your joint, knee, is easier to see on the knee. Your knee is swollen. And the reason for that is, again, to protect your knee, your body increase the production of the liquid that leaves within the joints. So they start to produce more, and you will notice that there is a swallow in your joint. And then you have to remove this liquid, this exacerbation of liquid that you have within your joint, because this will help to decrease the pain. So this is one of the invasive treatment. And I call it invasive because you have to put a needle within your joint and aspirate it. Then you have arthroscopy. Arthroscopy is when you put some visual tools within the knee to have a better visualization of what's going on inside. You have osteotomy, and I'm going to be talking about osteotomy a little bit more in one of the next slides. And you have the joint replacement. Probably all already heard about joint replacement. Different types, different joints, different modalities. So you're going to be talking about joint replacement. Particularly on the knee, we have two options. You can make a partial joint replacement. You can have a total joint replacement. This is what is the arthroscopic surgery. So you have the scope that is put inside your knee, and then the surgeon will have a better visualization of what's going on. What kind of damage do you have already in your joint? This is the osteotomy. And the importance of the osteotomy is many times if we divide the knee in two halves, internal and external. So internal and external. And normally the internal part of the knee is more damaged. So sometimes when you cut the bone, the tibial bone, and change this angulation, it helps to have a more stable knee. This is what is osteotomy. There is a lot of any surgery, anyone, even if you're going to extract your tooth, any surgery, any procedure have some risk associated with that. Won't be different for any of these surgical options that I mentioned. So you have infection, possibility, blood clots, another possibility, stiffness, losing, failure of the implant. All this can happen, but these are risks. And we have to mitigate this risk as much as possible. So then you will enjoy the benefits. The first benefit is the pain relief. Nobody is supposed to live in pain for any reason. Any reason. Emotional, physical, pain is not part of our DNA. We have to be happy, healthy, and live our life full extent. So any kind of pain has to be addressed, has to be taken care of. So, and one of the best benefits that we have with joint replacement is the pain relief. The other thing is you're going to restore mobility. Because normally, when we are in pain, the first thing that we do is stop moving. If my knee is hurting me, what I will do, I will lay down and let my knee rest. Big mistake. Big mistake. Acutely can help, but chronically, this will increase the damage because when you don't move, your muscles get weaker. If your muscles get weaker, the main holder of your knee joint is the muscle just above it, the quadriceps. So if you don't have a very active muscles, your condition will be aggravated. So we have to keep moving. You have to keep activeness. So, and then when you start to move, you start to get a healthier lifestyle. Because then you can move, you can dance, you can walk, you can, moving means. So when you start to feeling pain, let's investigate. Why is the cause of this pain? And then let's deal with the pain, let's treat the pain, and let's avoid to be stopped. The pain cannot stop you. And then, of course, will enhance your independence, and the quality of life will be increased. And this is something that you have to keep in mind. Quality of life. So anything that is stealing from you the quality of life, we have the power to change it. And your doctor should be your partner in helping you to have a better life. Okay. Some studies show that African Americans versus white. So this is talking about the willingness to consider joint replacement. And it looks like for a study that is being running that the African Americans has less willingness to have joint replacement than the white population. Females has less willingness to have joint replacement than males. So African American females comparing to white females has less willingness to have joint replacement. And African American males compared to white males also have less willingness to have joint replacement. You have to change that. We are in the power. Okay, you know what? I don't want to live in pain anymore. What can I do? How can you help me? Do that. You have the right to do that. And this is another consideration that another study is telling us, that comparing white, the headline, with black population, the purple line, we have some, the black population has more concerns about the outcomes, results, and about the surgery. So, and when you look at this graphic, you see that the black population is more concerned about difficult walking post-procedure pain, recover in the 6 months, hospitalized in 6 weeks, understand joint replacement, family and friends had joint replacement, and hear of joint replacement. So, it looks like there is a lot of things that you can gain if you ask. Say, hey doctor, what can you do for me? How can you work together? I don't want to live in pain anymore. Go there. It's your right. You have the right to live a better life. Go for it. Ask them. Be annoying. Ask them. Be demanding. It's your right. So do that. And there is a lot of options for you to feel better, to live a better life. So go for it. Look for it. On the knee specifically, there are 2 types. I already mentioned this to you guys. There are 2 types of knee disease. One that is only compartmental, and when you look at this graphic, so remember that I mentioned to you that if we divide the knee in a line, in the middle of the knee, we have the medial compartment, and and you have the lateral compartment. So when I divide the knee here, I have the medial and the lateral compartment. Normally, the wear happens more often in the medial side. So the medial side gets more aggravated when you compare with the lateral side. So in the medial side, you have more osteophyte, more damage, and more angulation. So you have the bow legs. Normally, this is the first sign of deformity for osteoarthritis, is the bow leg. And here is the x-ray of exactly what I'm talking to you about. So this is the lateral side, and you see the space is bigger than in the medial side, that the space is smaller. And this is the x-ray representative of what is a unicompartmental disease. And when you have the unicompartmental disease, what that means, only one side of your knee is being diseased. So if you look at here, you have the both sides, the lateral side, the medial side, and when you look at this scheme, it says that it's showing that only in the medial side you have the disease. So this is exactly what you will see. So if you just have one side of the knee that is being diseased, you have the ability to treat just this one side. So we have what we call polycompartmental procedures. And this is the polycompartmental knee replacement. So what is important for Johnson & Johnson, the Q-Synthes, is we have to be mindful about the variability of conditions that a patient can present. Because then, if I understand this variability, I can tackle each one of this variability in terms of resource, in terms of treatment. So, when we understand that there is some disease that just affects part of your knee, we have to provide you with the options of treating that part of knee that is diseased. So you have some options that we call polycompartmental knee replacement that will be tackling only the size of the knee, the side of the knee that is diseased. And you have the multi-compartment. So in this knee here, you see that there is no space in neither side. So neither medial, neither lateral. So the entire structure is affected by the disease. So for that condition, we have the total knee replacement. So instead of treating just one part, one side, you're going to treat the whole knee because the whole knee is being affected. So you have this option as well. This again, another picture of the multi-compartmental disease, where you see no space in the joint, a lot of bone production, and this is super painful, very limiting, because with the need in that condition, do any kind of movement like, regular extension and flexion, it's very painful. And so this is the total knee replacement. So this is the prosthesis itself, and this is the X-ray when you look at from anterior posterior view and when you look at the lateral view on the X-rays. So what is the hip replacement that I am talking about? It's pretty much that. It's a surgical procedure that removes all the diseased part of your natural knee and replace it with implants. And these implants will help you to live a better life. So how this works? Arthritis, with a lot of production, with bone-to-bone contact, with a lot of inflammation. So when you see a hip like that the options that we have is to have a total knee replacement. And this is how is the scheme of a total hip replacement. So you will have a new cup. So here, you're going to remove all this disease, and you will insert a cup and shell, and then on the femoral part, you're going to insert what we call stem. And in this area here, the stem and the cup and shell will match together. And we call that the bearing. Then it's just one style, one model, one type of product? No, tons of them. Different size, different shapes, different connections, different material. And maybe my hip osteoarthritis is not the same of his. So his needs are different than mine, and her needs are different than him. So as an industry, we have to provide the different portfolio to tackle each one of the individual needs. So we will hear from your doctor that the bearing of the hip replacement, blah, blah, blah. So what is the bearing? Is exactly this area here, when the femoral part met with the acetabular part. And here is where the bearing happens. So this is why we call this bearing. So the bearing is the union of the ball and the cup or shell. So this is where the movement will be happening. And after when I finish here, please go to the booth, because there is some models that you can see to understand better what I am talking about. So you're going to see some models, and the Q-Synthesis team will be there helping you and clarifying. I will be there as well. So remember that I told you that we have different shapes, models, material. This is what I am talking about. So these are the three pieces of a hip replacement. So you have the ball, the head, you have the liner, and you have the cup and or shell. These three pieces come together to produce the movement. This is the bearing. And we have different materials to do that. We have metal, you have polyethylene, and again, you should discuss with your doctor which option is the better fit for your case, for your needs. So our obligation, Johnson & Johnson, is to provide your doctor with the best portfolio possible to attend different needs that the patients may have. And when we interview patients that had already some hip replacement or knee replacement, what they say is, so in a recent study, 600 people who choose to have the hip replacement. So more than 96% of them enable them to move freely. This is the testimonial that they have. And 90% said that they were able to participate in their favorite activities. So can you imagine that? Leave from the chair, the sofa, the couch, and get back to some activities that may be dancing, walking, get something on the floor, take care of our grandkids and kids, whatever, you name it. Again, you have the right to be active. This is what the life is for, to be active, to be healthy. So, again, I will reinforce that as much as I can. There is another study that showed that 95% of patients that had Corio and Pinnacle, two of our portfolio products from Johnson & Johnson, the Q-Synthesis, they have after 10 years of surgery, they don't have to do any reoperation. So this is remarkable. So you can imagine if one of you has, even with pain, 10 years after the surgery, free of pain and more active, you know, this put a smile on your face. So we have to have it. So let's do a little quiz here. What do you think, the first question here, how many people in the United States you believe that undergo knee replacement surgery each year? Which of the three options do you think that is the right? C. C? Everybody? B. I wish I could give you a preview because you were right. 790,000 people has knee replacement. It's impressive. The number is pretty big. And when you have 700, I never know how to say numbers in English, help me. 790,000 patients having a surgery and active, back to the life. So, you know, this is remarkable. This is beautiful. So this is what we are here for. Second question. What disease is the leading cause of disability in the United States? Heart disease, diabetes, or arthritis? What do you think? You're so smart. Yeah, you're right. You see, arthritis is a big cause of disability in U.S. So, you know, you have to keep moving. You have the right to. Let's deal with arthritis. Now we are very concerned about some myths that we have out there. And we list 5 big myths that you think that we should clarify to you guys. So let's go one by one. So, myth 1. Arthritis span is just part of aging. It's just something you learn to live with. Really? You believe that? Of course not. We don't have to live in pain at all. At all. You know, charge us, charge the industry to give solutions to you guys to live a better life. This is what we are here for. We spend tons of dollars to create new resource to, you know, afford you guys a better life. Charge us on that. So, what is the reality about this myth? Conservative treatments can lessen pain but may prolong limited function. Remember that I mentioned this to you guys. So, we cannot just get rid of pain and think that everything is okay. Maybe it's not okay. You should investigate a little bit more. You know, so let's see if, you know, just because you took some medication, I'm cured. Cure with osteoarthritis is not appropriate because when it started, don't get bad. But you can avoid to get worse. And this will be a big win. Almost 1 million Americans choose total joint replacement annually. Remember, we saw, what is the number again? 7? Okay, 7. And sometimes you do the different. Sometimes you say, just to confuse me, sometimes you say 7,900, right? This is not easy for a foreign perspective, I'm telling you. So 7,900 is the same thing that. Thank you. So you were familiar with the number, okay? So thank you. What is our second myth? Total joint replacement won't feel natural. And this is a very fair assumption because you have something within your body that is not yours. It's not, you know, it's fabricated in Johnson & Johnson. So I will feel right, I promise you. You won't feel anything. When it's in there, okay, for the first month, you have the effects of a surgery like any other other surgery. If you have your belly operated for, for the ladies here that have C-section for the first weeks, you know that you have something wrong, right? So, but it will go away. And after that, after the inflammatory, gets solved, you want, every time that you move your knee, you won't feel that you have something inside. I promise, you won't. If this happens, something is not right. I am too young for joint replacement surgery. This is another myth. And this was true some years ago. Some years ago, when you start developing joint replacement, the interaction between the material, the metal, with the bone was kind of concerned. So after some years of doing that, we get, the products get more appropriate, and now we can use, because the concern that we had before is that the wear will be massive when you have something artificial within your bones. Now we change the mindset because you're specifying and being more focused on how you build the prosthesis. So this is not a reality anymore. Total joint replacement are not based on an age, but on person's level of pain and capability. So that is, again, there is no one fits all, but probably will have some specific design of prosthesis that fit your needs. We have to discuss that with your doctor. The fourth myth: I should wait as long as possible to get a total joint replacement. Again, not true. When you postpone the solution, you are aggravating the condition. So as much pain you are feeling, more inactive you will be. Inactivity means that your muscles are being weakened. Inactivity means that your joint is being more damaged. So, studies have shown that as soon as you start taking care of that, better will be the outcomes, better will be the results. So don't wait too much. Studies have shown that waiting surgery generally worsens the outcomes, and delaying surgery lowers quality of life, not only before operation, but even up for 2 years on the following surgery. So even after 2 years of the surgery has gone, you still have some. So don't wait. And this is your power. This is what you can do. You start feeling something, you start noticing that something is not normal, go, look for help. Again, be the man. You have the right to do it. And the fifth myth: all joint replacements are the same. Absolutely not. And again, with the evolution of the technology, today we have a huge portfolio at the Q-Synthesis of joint replacement. So, and the intention is each family of products will be designed to tackle a different need. So, discuss with your doctor which one of the entire portfolio will be the best solution for my case. And the case varies. So, has to have something outside that will be the perfect measure for your case. Guys, thank you so much. This is what I have to bring to you today. I will be here if you want to ask some questions. Thank you so much. Thank you so much. So, if I can help you try to find some doubts about the disease, I'm not supposed to give you any advice in terms of treatment. I'm not allowed to. But if you want to discuss some questions or doubts that you have about the disease, I'm more than happy to help you guys. And I would suggest, when you have a chance, go in the booth and check out some of the prostheses that we are discussing here, that we may clarify some of your doubts. And Johnson will be there to help you out with your questions. Thank you so very much. And I need any doubts that you may have, please raise your hands and I will try. What's that? What they will do with the paper that they fill out? Leave it on the table. Thanks, Senator. Okay.
I think Johnny Gill was on his way.
Yeah. Justify my presence here. Tell me. Let me, I don't know if you, thank you.
I'm gonna walk around. If you got any questions, hold them hands up.
Okay, I just have one question. First of all, your presentation is great.
Thank you.
I noticed you didn't say anything specifically about diet, exercises, or other options. The focus seemed to be really on joint replacement. So I was wondering in those other areas, like what are some recommendations for people to do other than going straight to the surgery?
Absolutely. I think that we brought up a big point. Again, you have to think that anything that overstress the weight supporting that your joint is going through. So you see here, all my weight is over my hips and my knees. So if I'm having something, if I'm carrying on a stone, this will be more effective because I'm imposing an weight. So anytime that you increase your weight, stop, thinking the solution. Go to dietitian. Start to thinking about how you can manage your weight to avoid this extra, you are extra imposing more damage to your knee. So you have to be very mindful about that. Don't take any risk. If we're starting to notice, and this is part of the aging, get a little bit more weight is part of the aging. It's natural, not necessarily. So, but we have to be mindful about it. As less as you solicit your joints, healthier they will be. Clarified? Thank you. Sure.
And again, also thank you for your presentation.
Thanks.
And the information that you shared. I was told back in 2022 there was research being done for artificial joint stimulation. What can you tell us of what research is now and
This is pretty much about artificial joints. It's exactly what I told you. It's the joint replacement.
cartilage fit between the joints is what I'm looking for. The research of the cartilage fits between the joints. Because that's what wears out. It's not necessarily the bone.
Yes. The cartilage is the starting point. So the disease, the osteoarthritis will start in your cartilage. But after some time, because of the bone beneath it will figure out that something is going wrong, and he will start to try to help the cartilage above. So at some point will be a full disease of osteo and arthritis. So this is why the name is osteoarthritis, because it's a conjunction of the two structures. So both will be.
Replace just the cartilage.
There is some there is some search being done. Nothing today that I can say to you that, okay, there is an option for that already in place. But there is some studies being done.
I'm coming around. We got some more here for come. Next thing you might know.
Okay, I know you're talking about the knee and everything. I want to know about the back. I got the back. I got two people up there, cancer nerve arthritis. If one can go in there, do something about it, yeah, on the left. So if I get about 40 years there, then my knee, like fit my cartilage, deteriorating. And then they never fit in the bottom.
Remember that I mentioned that systemic disease. So can be, and the spine as well is a very supportive joint. So can be happening anywhere in the body. So can be in your spine and can have some other unfold situations related to that. So again, the same measures, the same takeout that you were talking about knees and hip, same applicable to the spine. Because it's a systemic disease, so can be anywhere in the body, can be just in the hands. So you see a lot of people that has, the articulations in the hands swallow, increase. This is osteoarthritis as well. So, it's a systemic disease. Can affect any joint in your body. It's more prevalent in the joints that support weight. So spine, hips, and knees. Same measurement, same take care that you should do. That you should do for hips and knees. You should take care same way in your spine.
Dr. We're glad to have you today. My question is, what can we do to build cartilage?
Say it again.
What can we do to build or strengthen our cartilage?
That will be wonderful if you can do something that specifically driven to the cartilage. But there is some things that you can do. The things that you can do or you can avoid is be active. Movement is a big thing for the articulation. Because as much as you move, we have a liquid inside the articulations, all of them, all the articulations that protect your joints. As much as you move, more productive will be the tissues that produce this liquid. So your cartilage will be more protected if you keep moving. The muscles around the cartilage, around the joint, has to be strengthened. So keep moving. This is the best thing that you can do. Avoid overweight, keep moving, keep healthy and activity, and that you will be protecting your cartilage very much.
We're going to have a couple more questions. I know I got some over there. We got one or two.
If you have a pain, how do you know whether to use a hot or cold compress?
I couldn't hear, so I'm sorry.
If you have a pain, how do you know whether to use a hot or cold compress?
It varies, but the response will be very individual. Me, for example, I hate any treatment with cold. So don't ask me ice on my joint because it will aggravate my pain. So this is individual. There is a lot of people that think that when they put ice on the joints, have a very good result. So it varies, but hot and cold both can help. It's a matter of preference. It's a matter of how this works better for you. Pick one and go.
Thank you for taking my question.
Sure.
So how long does a total knee replacement or a partial knee replacement, how long is it good for before you have to redo it?
So, great question. Now, what the studies are showing is that with the advance of technology, we have 10 years lasting until you have to do something else. So 10 years. It's a great number, isn't it? So 10 years of no pain, 10 years of activity, it's a great number.
Thank you, ma'am, for the question.
Sure.
I've had knee surgery for both years. Second surgery I had, they put them on me. I had suffered from that for 2 years. Now I've got new knee, and it's not good. It's just happening. I'd like to know just how long am I supposed to go through this after
I'm very sorry to hear that. I don't know what's going on. I don't know what is the cause of the situation that you're facing.
to start out, they put the wrong knee.
Yeah, probably, I would need to see the x-rays and what is wrong, why that one is not appropriate for your case. So all the stuff has to be discussed with your orthopedic surgeon. So if the first one failed, maybe it's a good advice to hear a second opinion. So look for someone else, show the history, show the x-rays, and ask them opinions about. Again, I think that we have to be, each case is one case, and we have to know what is the reason of failure. We have to figure out what is the reason, why I have 2 cases of unsuccessful joint replacement. What is going on? What is not doing in the right way? Okay? Investigate that. Listen to someone else. You deserve to be, active.
All right. Thank y'all for the question. We got time for one more question. All right.
Oh,
Well, I mean, we can keep going if you want to.
sure.
Anybody got more questions, let us know.
My question is it rumored or is it mythical to believe that usually when you have surgery on one, you'll need it on the others? Like, I've heard that, well, if you had knee replacement on this one, you'll need it on that one, and eventually it'll be the hip, and eventually it'll, you know what I'm saying?
Mix of myth and reality. I will tell you why. Remember I mentioned that osteoarthritis is a systemic disease. So the same trigger, the same fact that triggered the first situation that you have in one knee will be happening in the second knee as well. So it's not that the surgery is causing the second procedure knee, it's the disease itself. And sometimes you may have it spread different joints.
Kind of like a part 2 question is, can you have it in multiple areas?
Absolutely. And you know what's happened as well? When you have a pain in that knee, I will sacrifice the other one because I start to limp. So I put much more weight on the healthy knee. So somehow you were helping to aggravate the healthy knee. Okay? Sure.
I forgot what I was saying. That the weight loss for the hip surgery, my daughter just had the surgery earlier this year, and her doctor told her she had to lose the weight before the surgery. She's fine now. But my neighbor across the street is I guess it's the difference in your doctor, heavier than my daughter, and she didn't have to have the surgery. So is there just the doctor's preference or however?
We have some best practice, and ideally, we have to have a better way to do the surgery. But you know what? Sometimes happens that the patient is in excruciating pain and he is overweight. So what I will do, I will wait until he loses pain and let the guy in excruciating pain know. So what will happen, this may affect the outcomes because they are still dealing, even with one artificial joint, still dealing with a lot of demand for the joint. So this may affect the outcomes.
Did I understand you say earlier that you had the knee surgery has a lot to do with hip surgery, or you have to replace that?
All the hip replacement ideally should be done with less weight, ideally. But again, it's a matter of risk and benefits, and I cannot let the patient in excruciating pain and wait until he loses 30 pounds.
I enjoyed you very much.
Okay.
You brought back a lot of memory. I did symptoms that they with you for Ryan Hospital for 40 years. I set up for all the orthopedic surgeons, and it was very interesting. I'm retired now. So thank you so much.
Thank you. Thanks.
All right, thank you. Any more questions? Okay.
That's not right. That's not right.
Good afternoon. I'm a victim of the bone-on-bone crash of the war out. And
Me or you?
me. And I've been dealing with pain for a long time. I'm hearing that you can go get the chromosome shots. Why are they not 100%? I've heard different people go get the shots. Maybe 2 weeks later it's not effective. Maybe a month later it's not effective. I was thinking about going to get them, but I don't want to think anything that's not going to be effective. So I'm always in there. But since I've been wanting this quality life, moving more, exercising, I went to chiropractor, doing ultrasounds. Oh my goodness, it's easing the pain. So I'm finding things to ease the pain. I know the weight is the number one issue, but you know that takes time.
Takes time, yeah.
It takes time with the weight.
Step by step.
But I am finding things to ease the pain. But you know, I'm just wondering if I invest in giving those shots, is it 100%? I hear people say it's not 100%.
The problem with medicine is we have to have long-term studies until I can tell you this is effective. I have to test that in tons of people to say this is effective. So until we get to that point, I cannot say that it's 100% effective because we don't know yet. They're investigating. So, you know, measure it works. If you have some other measurements to help you that are already proved for that first. You know, just try things that are not proved if you don't have any other resource available, okay?
And thank you for all the good information.
Sure, thank you.
Okay, thank you for all the good information. And I guess I'm exempt from most of you because I don't have any pains. I had ophthalmic surgery on my knee. And my son told me, he said, Mom, inflammation is what causes pain. I take turmeric and curcumin, that's a herbal. I don't have pain, but I do exercise. I go to the Y almost every day. I keep doing the things, eating right, exercise, staying active, line dance, race dance, all that. But if you don't do the things that you're supposed to do, to ease the pain, then you know you will have the pain. But just taking the herbal, turmeric and curcumin and all that for the inflammation which causes pain, which you know us too. And exercise is very important.
Yeah.
Eating right is very important.
Absolutely.
And I did want to ask you, half of my knee, you know, when they did ophthalmic surgery, the half is, you know, they cleaned it up. But, you know, I try to keep my everything strong by doing the exercise so it won't become weakened. But will the disease continue? You know, will I continue to?
It will, but you will be crucial in how the disease will, you know, progress. So if you are taking the good care, if you are avoiding things that should be avoided, like overweight, eating right, exercising, have your muscles active and strength, you are doing your part.
Okay, very good. Thank you so much.
Sure.
My question is, once you have osteoarthritis pain, and I know some people get shots, is that just staying off surgery, or will those shots help in the long run?
Depends on what shots you're talking about. If you're talking about hyaluronic acid injection, this helps a lot tremendously in restoring the cartilage. So it will help the cartilage be healthier. But this is the shot that I'm talking about, hyaluronic acid. Any other shot, as I explained to the other lady there, it's still investigation, under investigation. So be careful, you know, inform yourself, look for your doctor, and see, okay, can you show me the evidence? Because sometimes the doctors can be very creative, you know, and say, okay, you know what, I hear that if you use this and that, and if you take a shot of whiskey, will make you feel better. So you can take the shot of whiskey, but don't think that this will, you know. So, show me the evidence, doctor. Do you have something in the food that I take a look, that I can, you know, be informed? This is your, you know, best ally.
All right, so this will be our, because we got more things going on. This will be our last question, but the doctor will be in the back. So if you have any questions on lunchtime or whatever, she will be able to answer your question. But this will be the last question for the forum, but she will be in the back. So y'all can go back there and ask her some more questions, all right?
First question is there cure for rheumatoid? First question is there a cure for rheumatoid arthritis?
No, unfortunately not.
Okay, I just got rheumatoid arthritis, my right knee. But what works for me, exercise is like every 6 or 8 months, I get a cortisone shot.
Yeah.
But the cortisone shot, it works.
It doesn't work or works?
It does work for me.
Because it's different than everything that you're talking here. Osteoarthritis is not an inflammatory disease. Rheumatoid arthritis is. And so the approach is different. The measurement to take care of it are different. So different outcomes, different results, different treatment. But unfortunately, no cure. No cure. But again, same as I speak about osteoarthritis, you can select ways to tackle it to live a better life. There's a lot of resources. Cure? No. But not necessarily to be cured to provide you with a better life. Okay, so talk with the doctor. And normally, the specialty that treats this kind of arthritis is the rheumatologist, not the orthopedics. It's not the orthopedic surgeon that treats that, it's the rheumatologist. So talk with your rheumatologist about it. You have to figure out which shock you're talking about. Because there is some shock specifically for this type of arthritis, there is some medication that is very effective. So, Don?
Let's give Doctor another hand.
Thank you so very much. Thank you.
All right, listen, that was a lot of information, and like you said, she will be in the back. And I know some of y'all ain't really being honest. A lot of y'all ain't really being honest on why y'all got the arthritis. Y'all been beating them kids too much. Y'all been beating them kids. Some of y'all got that elbow arthritis because you've been beating them kids. See, they don't beat kids no more like they used to. And some of y'all got beat-itis. Y'all been beating them kids. Amen. You say what? Yeah, but it's good information to know, and like you said, you make sure that you prevent, because I love to eat. I love to eat, amen? But we gotta watch what we eat. And I'll be watching it while I be putting it in my hand. I watch everything. I watch everything I put in my hand. I'm like, I'm watching this eat. But it's very important, and like I said, if you have any more information, or if you want any more information, and some of the things that she's basically saying is, we just got to start taking care of our body, amen? That's one of the major things is, even if you're an age, you can walk, because we're gonna see some dancers later on, and then we're gonna be doing some great things. But most of all, one more time, I want to give Miss Janet another hand. Let's give her a hand. Because she's bringing information to you guys for you to understand how to live a better quality life. That's what life is about. So we about to get to eating. We just talked about watch what you eat. I don't know what's over there, but there's a lot to eat. So however we're gonna do, we ready for lunch.
So we want you to get up and move around, go to the exhibit table, ask questions. When you come back, your lunch is going to be on the table. Before you do that, let me ask you this. How many of you want veggie? A veggie sandwich? Okay, I got 1, 2, pardon me? Veggie sandwich. Okay, I need, okay, the box lunches is going to be delivered, it's going to be put on your table. So if you need to go to the restroom, if you want to go see the exhibits, feel free to get up and walk. And then you can come back and eat, okay? Thank you.
Has been